Welcome. My name is Mrs. Madi Partovi,
And I'm Dr. Ryan Partovi.
and in this episode of the Partovi Effect, we are going to broaden your perspective on cancer. I'm going to approach it in this way. There are ways that cancer is depicted in the movies. Once somebody is diagnosed with cancer, you see them go right to the meeting with the oncologist, and then you see them getting chemo. And there's another depiction on the other end of the spectrum where an individual doesn't want anything to do with that and goes the complete holistic route, and then they die.
I wouldn't say holistic. That's the only thing I'm going to just briefly push back on. People who don't, so holistic means taking into account the whole person, mind, body, spirit, holistic. It's an integrated approach to healthcare. What they're doing is they deny science and they have a view which is that my cure will come completely through nature, and science doesn't have anything to tell us about nature. Nature is whatever feels right to me, whatever pathically or intuitively feels like what I should be doing, that's what I'm going to pursue. And no expert has anything to teach me that my body can't already teach me. I think that's probably a fair representation of that view. Maybe I'm wrong, but if you feel like I'm wrong, correct me. But I want to clarify, because what we do is very holistic. But what I would argue is that, what I said, mind, body, spirit, right? So I think a lot of the people you're talking about, they're looking at the spirit, they're looking at their body, but it's like the mind doesn't have anything to teach them, right? So we're going to just cut the mind out, cut out science, cut out reason, cut out logic, and say that doesn't have any part to play in my health. That's not holistic, right? Holistic takes into account mind, body, and spirit, all three, right?
I absolutely agree. I'm absolutely aligned. And you really touch on a very important distinction, because once the word holistic is used, like you're telling somebody I'm taking the holistic route, right? It comes with so much stigma. And people will tell you, there's like a whole mob of people that will tell you that you're stupid and that you're going to die doing what you're doing.
See, for me, I have the opposite reaction. As an actual holistic doctor, you tell me you're going the holistic route, I'm going to ask, okay, great. So what conventional treatments are you already doing? Is the first question that pops in my head, right? I'm like, oh, you're probably doing surgery or radiation or some kind of drug or something. And then you're coming to me because you're wanting to add some natural things on top of whatever, to me, that's a holistic approach. Again, a unified mind, body, spirit approach, integrated approach. But you're right. People sometimes hear the term holistic and they think, oh, that's like the opposite of conventional medicine, which is not how I see it as an actual holistic physician. It's not how I see it at all.
Yeah, so we're here to clear that up, and we're here to open up a whole new world around looking at all the possibilities that are available to you should you be diagnosed with stage 3 or stage 4 cancer.
And you say stage 3 or stage 4, I think probably because most people are not diagnosed at stage 1 or stage 2, except maybe if they're in our practice or maybe another, naturopathic or integrative holistic practice where they're doing more detailed, thorough screenings.
Correct. And I would like
I would say breast cancer with the mammograms, they do sometimes catch things at stage 1 and stage 2, but many other cancers, they don't. And so often you are dealing with stage 3 and 4.
Yes, I'm talking about the conventional medical system. I'm talking about doctors telling you that you're fine and your labs are normal. And then one day you come in, oh, you're stage 3.
Yeah.
What happened there? We'll touch on that as we go on. But I really want to start with so you've just been diagnosed with stage 3 or stage 4 cancer. What is available to you? conventional route is to go to talk to an oncologist. They'll mostly recommend.
Most oncologists that people are going to see as a first line front referral from their primary care physician are actually what are called medical oncologists. And medical oncologists make 60 to 70% of their annual income from the markup on chemotherapy that they charge your insurance. And look, there's nothing wrong with that. Medical oncologists have to put their kids through private school too. That's a joke. One of my favorites, actually. The point is that they don't tell you that, right? Nowhere does it say in the documentation or in the onboarding. I think we've had one patient say that their medical oncologist told them that chemo is their main way that they make money, like 15 years. But which that medical oncologist maybe is a good one. That's one you may actually want to stick with. But usually they're not telling you that. And so usually what they're doing is immediately saying, oh, we need to shrink the tumor. Let's do a few rounds of chemo, or oh, this is the particular chemo regimen has a 90% remission rate, but we're not going to talk about the 10-year survival rate. And that's what you over and over again. And if you find a good one or one with some integrity and you have an operable tumor, usually the first thing they're going to do is refer you to a surgical oncologist to get that tumor removed, or at least as debulked, as much of it as possible removed. A lot of times medical oncologists, I have literally had patients be told, oh, let's do a few rounds of chemo to shrink the tumor so that it's an easier surgical recovery. And then in the process of them going from stage 3, which is still contained within the organ, to doing a few rounds of chemo to shrink the tumor, which didn't work. Because a lot of times when you have a tumor that's well encapsulated in the tumor, it hasn't spread yet. But through the process of doing the chemo and breaking down some of the body's own protection, because remember, chemo is like using a nuke to kill an ant, right? You're going to do a lot of collateral damage. And so as a result, you end up a lot of times actually encouraging the transition from stage 3 to stage 4, which is metastatic cancer at that point. So you have to remember that the body has ways of helping to contain and constrain that cancer. And when you think you do know better and think you can do better, and you go in and basically use a treatment, whether it be radiation, whether it be chemo, that in the process of attacking the cancer also knocks out the body's own response, or at least severely constrains it in that area, there's also the chance that you're helping the cancer escape, right? That's not something you're going to hear from your medical oncologist, but I think it just makes common sense if you think about it. And I've seen it over and over and over again. And then, well, no, now we can't do surgery because it's not going to be effective in your case because you have stage 4 metastatic. So now all we have to offer you is more chemo, right?
So that conventional approach is very algorithmic. It's very cookie cutter. It's absolutely not individual.
Yeah, not only that, I think, you're obviously speaking to some of the realities of conventional oncologic care, but I'm going to go even further and say that approach to me is clear profiteering. And in my view, it's criminal. It's not just malpractice, it's criminal. But here's how they can get away with not calling it malpractice and saying, oh, because it's the standard of care. And we've talked about it before. I'm sure other people have heard about it from other podcasts and other shows. They created this thing, the standard of care, so that if you follow the standard of care, you can't basically be successfully sued for the outcome. Even if there was another treatment that was not the standard of care that might have resulted in a better outcome, or even was likely to result in a better outcome for you, because they followed the standard of care, you cannot sue them successfully and win anything because they followed the standard of care. And the standard of care, what we found more recently, certainly in the last decade, more and more, the standard of care is determined more by what is going to result in the greatest profit for the greatest number of doctors and hospitals, and industrial actors like Big Pharma, than what is going to result in the best outcomes for each patient. Because a true standard of care would actually, at least to some degree, be algorithmic. Well, if the patient has these risk factors, maybe you try this first. And if the patient maybe has this genetic differences, then maybe we don't take this approach, or we take this other approach instead. But that's not how the standard of care works. The standard of care is diagnosis, whatever the diagnosis is. Okay, that's the diagnosis. Now here's how you treat it. You try this, and you try this, and you try this, and then you say, there's nothing more we can do. Sorry, maybe go try to find a clinical trial. And that's how conventional oncologic care works. And there's really nothing that could be more, frankly, the opposite of how what we do is.
So you've been received into our medical practice with either stage 3 or stage 4 cancer. What is our approach? Like, where do we start? Where do we begin? And what are your choices? If you were to have an oncologist that you like, that does agree with you taking repurposed drugs and is familiar with that personalized nutrition makes a difference on this journey, and it is aligned with the naturopathic, integrative, holistic view. Let's start there.
I was reminded by, there's a story Dr. Diadamo likes to tell, where there was one of his patients that had brought his book, Eat Right for Your Type, which was his first book, a lot of which was actually developed through his work in oncology, on patients with cancer. And this patient was participating in at the local hospital, like an oncology roundtable, and had brought in the book to share with everyone. And the hematologist oncologist happens to be walking through the area where the people are, and he sees the book, and he says, "That book, my patients who have that book, they do well. So keep doing whatever it says to do." And then he just walks right out, right? So to me, that's probably the most positive story I've ever heard of a hematologist oncologist saying that diet matters, right? You said that if you have one that says diet matters, hey, like, that's a gem. But it's like maybe a 1 in 100, and I'm being generous, Jim. Okay. We just haven't seen it. So yeah, I mean, what was the first part of what you said again?
To start with, somebody that, like their oncologist,
Right.
Your oncologist is listening to you as far as everything else that you're doing. Food matters, and nutraceuticals like food-derived medicines matter, and you have respect for your oncologist.
Sure.
And so how would our practice fit in combination with the conventional approach of treating cancer?
Yeah, so I think we have 3 cancer options. I don't know if you really want to jump right into that.
We do.
But, I think, to me, option 1 or option 2 is a good fit for that scenario. So what is option 1? Option 1 is essentially access to ivermectin, mebendazole. So first, before we even get into that, we should talk about what repurposed drugs are. Because you mentioned the term repurposed drugs, I'm starting to talk about ivermectin, mebendazole, and people are going to be like, wait, why those drugs? I thought ivermectin was for COVID or parasite, depending on what news media you listen to. But the point is that, and the answer to that, by the way, is both. It doesn't really matter, because medicine is nonpartisan, right? We don't care what media you listen to.
Yes.
But let's talk about repurposed drugs in cancer. Yeah.
I'm going to pause for a moment and let our community get, like, science is nonpartisan.
Yeah.
Okay.
Seems obvious to me, but
briefly, what are
not anymore, apparently.
Briefly, what are repurposed drugs, and how has it been a game changer that repurposed drugs is being introduced in really this bleeding edge treatment of cancer? Yeah, so I'm going to get to that, but I want to say one other thing about science being nonpartisan.
I think the thing about it is that the partisanship in our country has become so enmeshed with money and profit and industry that it behooves us, and it's incumbent upon all of us to do our own research into figuring out what are I mentioned right out of the start gate, right? 60 to 70% of the annual income of medical oncologists comes from chemotherapy, right? That they prescribe. Conflict of interest, right? Perverse incentive. Here's the thing. It's incumbent upon us to investigate every single perverse incentive that we're encountering, especially in the medical realm, probably in every area, but I'm going to speak to the medical side, before we start a treatment. Who's profiting from this treatment? If I do poorly, who profits off of that? Who's incentivized for me to do poorly? Who's incentivized for me to do well? Etc. So it's important that we look at that, I think, more than we look at, because if you see the degree to which industry has totally infected all sides of the political spectrum, you start to see how, yeah, we're kind of joking around about how science has become partisan, but I would say even more so, because of the financial interest in the outcomes of studies, especially in the medical realm. There's a reason why it's called now not just the art and science of medicine, but the medical industry, right? Or as I like to call it, the medico-pharma hospital complex, right? Because complexes are a big deal now. And frankly, strong support for that complex from every side of the political aisle, which is, frankly, in our view, pretty disturbing. But anyway, repurposed drugs. So the basic idea behind repurposed drugs is you're looking at generic drugs, which have been used in most cases for decades, FDA approved for other purposes, not cancer, that have been shown in multiple studies, most of the cases both in vitro, in a test tube, in vivo, sometimes in animals, and I would say often in animals and sometimes even in humans, effects against certain cancers, types of cell lines, different types of different cancers, and down to the point where we can look at their effects on specific receptors and specific oncogenes, which we know have a role to play in the development and growth and spread of cancer. So we can use those drugs, and they're often 10,000 times or more cheaper than chemotherapy, often covered by your insurance, and not always. Ivermectin, mebendazole, a couple other ones really don't get insurance coverage for off-label repurposed use anymore because of the fact that the industry has caught on to the fact that people are using them for that purpose. And so they're saying, no, you can't use it for that purpose. You must use the chemotherapy. And you may ask yourself, why would my insurance company want me to use a more expensive treatment? Well, they don't. But the people making those decisions of what gets covered and at what level and all that are all conventional medical doctors who profit from the current system and whose friends and colleagues profit from the current system. And the other sad reality is that the pharmaceutical companies are as much in on it as anybody else. And so when they have a study that comes out that shows, for example, that mebendazole is highly effective as an adjunct therapy in cancer, they decide to increase the price of mebendazole by 100 times. 1,000 times, actually, probably is what they increased it by. So now, in order to get it at a reasonable price, you have to look at other avenues. Unfortunately, we have Natural Med Choice, which is our prescription fulfillment service that we've partnered with, has been able to find compounding pharmacies as well as international pharmacies to help provide people with the medications that they need for their cancer care. So repurposed drugs are drugs that have been shown to be effective. Either they're already FDA approved for something else, they've been shown to be effective either in vitro, in animal studies, or in human studies. They have a mechanism that is known to target a particular cancer or a particular oncogene, gene that is mutated that leads to cancer growth and development, or a particular receptor that's only expressed on cancer cells, similar to, say, immunotherapy. So there's a lot of different ways that these repurposed drugs may work, but suffice it to say that regardless of your cancer, chances are there's at least a few repurposed drugs that are going to be helpful for you. So did you have any other thing you wanted to say about repurposed drugs, or
No.
get right back into option one?
I want to get back into how would repurposed drugs make a difference for somebody that's doing chemo and radiation alongside?
Sure. Because again, the standard of care has been established. If you're going to do a study in humans, you can't not do that. You've got to do that plus something else. And so a lot of the studies we have on repurposed drugs are also like standard of care plus propranolol, standard of care plus metformin, standard of care plus atorvastatin. The plus whatever the repurposed drug is, that group has a better outcome than the people just doing the standard of care. So, and then we get into the why and the how, but suffice it to say, that's how most of these drugs have actually been studied in cancer, is as part of the pre-existing cocktail, and just let's add in one of those. So, and yeah, what is you see better response rates, you see higher complete response rate, which in cancer is like when you have end up with no evidence of disease, and ultimately higher rates of remission as a result. So I think that the way these work is in a lot of cases by the way that the analogy Dr. Diadamo, my mentor, likes to use is, cancer and chemotherapy are like two prize fighters, and two prize fighters that have been going after each other for 13 rounds. A kindergartner can go up to either one of them and push them over. We're the kindergartner, right? And so the use of, and I've been doing natural cancer treatment, both as an adjunct integrative model, but also in some patients, as a primary methodology of treatment for 15 years. And what I would say is that, when we add the repurposed drugs, it's like a swarm of kindergartners, maybe. Like it's adding another level to really make sure that cancer just goes down. And the cool thing about it is when you have maybe half a dozen of these different repurposed drugs on board, plus maybe another half a dozen nutraceuticals on board, food-derived medicines, botanical, herbal medicines, you can start to get chemotherapy level effects with using interventions that have far fewer side effects. So it's pretty exciting. I think we're on the verge of really the end of cancer as a major killer in our society. It's that exciting, in my view.
Yes, I'm pausing because I moved. Because I've witnessed you like real time work on some cancer cases. Yeah, with this particular gentleman, he was a patient in our wellness plan. And you ran the cancer screening. You caught cancer at stage 1. Issue. And you were working on his case the other day.
I'll be right.
And then you exclaimed, "So long, cancer." And it was and you're right. Cancer blindsides not only the individual that's been diagnosed, but their families, their loved ones, and their friend circle, and their community when something like this happens. And I think that there's a view, like a story about cancer. You can see the images in your head, somebody being diagnosed and then they start withering away and then they start doing chemo and it could only go one of two ways. Like either like the Lance Armstrong way, you're able to beat it, or you succumb to it. And so when you diagnose this gentleman with stage 1 and you're going to work on so many different facets, there's just so many components that can not just like a one-way street that you can walk, but you've really expanded the possibilities for him getting well. And so can you talk about that? Can you talk about the power of the cancer screening that you employ, like in our basic wellness practice. Everybody should be doing this. You should be getting the cancer screening. And can you please touch on that?
Yeah. So some of you all may have heard of the early detection tests that are out there now, where we have these, I think it's called, it's either, oh, I've forgotten the acronym, but it's basically the idea that we can see on a molecular level if there may be some kind of cancer present. And it's using cell-free DNA, which, free DNA that's just in your blood. Same kind of technology that's used for cell-free DNA testing on mothers when they're pregnant to see if there might be anything going on with the baby. So this technology we can now employ to look for cancer. But in early stage, which is stage 1, stage 2, the detection rate is maybe 40 to 50%. So what I have done is developed in our practice I like to call it pan-tumor antigen testing, but a way to think about it is we're looking for all the different tumor markers, tumor antigens that can be produced by cancers. And it is substantially more sensitive. It's, depending on the cancer, 60 to 70% effective at early diagnosis of any cancer. So it's considerably more effective than the genetic molecular testing on a sensitivity level. So more likely to pick it up and more sensitive in those early stage 1, stage 2 tumors. And we do that at the 3-month mark for all of our new patients in the wellness plan. And we also offer it as a standalone offering. I think now we've decided to offer that as like anybody who just wants to do a cancer screening, they can do it. Now, typically we recommend doing it. I have an algorithm that I use in the wellness plan. We do a baseline at age 40, and then we're looking at it again every 2 to 3 years from 40 to 55. And then at 55, we start looking at them every year, because that's really when cancer rates start to increase pretty dramatically. And so we can detect cancer using this methodology at the point where it's the size of the head of a pin, right? Which means that it may not even be seen on imaging in a lot of cases. And what we can do, therefore, is we can actually begin treatment with anti-neoplastic therapies. Again, repurposed drugs, things like ivermectin, mebendazole, a lot of the natural medicines that we know are anti-neoplastic, things like curcumin, EGCG from green tea, berberine or dihydroberberine. There's several different things. I'm not going to go through all of them. But the point is that we can get started with those right out of the start gate and really target, and depending on which tumor marker is elevated, obviously we have options for evaluating inside the wellness plan. We do imaging for patients who come to us for the standalone and something comes back positive. We have a cancer diagnosis program that we can put you through and do all the proper imaging and make sure, okay, do you actually have cancer? No. Yes. If you do, then we can bring you right into the cancer options program. But if you come in as a wellness plan patient and it turns out, like the patient you were thinking of, that you do have an early stage cancer, then we can also transition you to one of the cancer options programs as well. You actually get a discount by doing it that way. So I think that I hate to say this because it's going to sound really arrogant, and I'm not 100% sure this is accurate, but amongst programs that I have heard of, we have the most advanced cancer screening and most rigorous, advanced, thorough cancer screening. We look at genetic risk of cancer, inherited cancer risk. I don't know of anybody else who's doing a more thorough job at screening for and evaluating early cancers than we do. Let's just put it this way. It's a lot more involved and in depth than, if you're a man I would say at most you're offered colonoscopies, maybe a low dose CT of your lungs if you're a former smoker, and digital rectal exams and PSA testing. If you're a woman, on top of that, you're offered, you don't do the PSA testing, right? But instead you do mammography. We don't really typically do mammography in our practice. I usually do breast ultrasound plus thermography, and then both of which don't involve any radiation, unlike mammograms, which do involve radiation. And then if either of those comes back even borderline, then we just escalate immediately to a breast MRI. And that it's arguably, I would say, more effective than a mammogram at detecting early breast cancer. Anything else you want to say about the cancer, either the cancer screen or the diagnosis program?
I'd like to move on to.
Oh, I do want to say one more thing about the diagnosis program. Another cool thing that we have now in our practice that has been made available is the access to molecular level liquid biopsies. So the idea being that we can do a blood draw now and in all likelihood help us distinguish whether a tumor is cancerous or not, without having to do an actual direct biopsy of the tumor, which carries about a 1 in, well, depending on which reference you look at, 1 in 10,000 to 1 in 100,000 risk of seeding healthy tissue with cancer cells, which I personally have seen in my practice. So I wonder if it's really that rare. Maybe I see all the strange, rare, and peculiar cases. Very possible. Statistically, it's really low that's going to happen. But like I said, I've seen it. So if we can do anything short of a needle biopsy or core biopsy, I'd rather do it. And so this new molecular technology is really exciting on that front to be able to do. I can't really say needle-free biopsies because you still have to use a needle to get the blood draw, right? But it's a liquid biopsy, so it's not blood-based.
Will you talk about what an oncology specific diet is? Once somebody's been diagnosed with cancer, there's all those questions. I've spoken to several patients, that start Googling, what should I eat? What should I avoid? And it gets really specific down to your genotype. And we have available this computer-assisted medicine program, a bioinformatics platform. It's like 100 doctors talking about you. And if you enter in health history and lab data, you know so much more than you've ever known about yourself and what's optimal for you and what's optimal for you during this time.
Yeah, so the Swami Genotype software we use, which is the physician version of the software that we use in the wellness plan, but it basically gives me access to a lot more customization. We collect over 200 variables: genetic, epigenetic, which is like the volume control settings on the genes, family health history, personal health history, symptoms, lab data, measurements, biometrics, measurements of the body. We put all that in there, performs over 12 million calculations, and generates an individualized nutrition plan, recipe book, meal planner for you, for where you are right now on your health journey. It's the most advanced form of nutritional personalization that I'm aware of. If there was something else more advanced, I'd be using it. Most people who you're going to go to, even naturopathic oncologists, will tell you, give you dietary guidelines. For the most part, those are going to be indistinguishable from cancer prevention diets. But just like with chemotherapy, you wouldn't take chemotherapy to prevent cancer. There are certain food and food nutrients that you wouldn't want to take to prevent cancer, but when you have active cancer, can actually help because they are explicitly pro-apoptotic. They help the body, they help the cancer cells commit cell suicide, which is what you want cancer cells to do, is to basically turn back on those mechanisms that cause them to go ahead and send themselves the way of the dodo, so you don't have to deal with them anymore. And it turns out that there's some specific foods and food nutrients that if you take them, if you're eating them on a regular basis when you don't have cancer, may increase your risk of cancer, But if you take them when you have cancer, you eat them when you have cancer, you're going to actually make the cancer more likely to commit suicide, which is what we want. So, and that's, I think, a common error that I see a lot in people who, like I said, they've started down somewhat of a holistic oncology journey. They have someone that they've worked with, but that person may not be as much of an expert in personalized clinical nutrition, using nutrition to prevent and treat disease as I am, and as the members of our practice are. And so as a result, I get a cancer prevention diet, which again makes some sense, but is not really what you want when you actually have active cancer. So the beautiful thing about the software that Madi mentioned is it actually has the ability to turn on essentially deep blue artificial intelligence and alter the values of the food based on the fact that you have active cancer, and also not even just the values of the food, but also the combinatorics of the food. So the different foods that should be combined together in the same meal to enhance the effects, the anti-cancer effects of those foods, which I like to call extra credit, because it is, for some people, is kind of, oh my God, can I even do that? And the answer is yes, you can, but you may not be able to do it right out of the start gate. You may need a few months to get there. But at the end of the day, like I said, it's an incredibly subtle and advanced way of approaching nutrition in the oncology setting. And I view it as a crucial part of the outcomes that we get in our practice.
Absolutely.
Not that you're not going to get some outcomes without the diet, you will, but I feel like those outcomes are ordinary compared to the kind of miracle type outcomes we see in people who really take on the full shebang. And, they really take on doing the diet and the lifestyle change, nutraceuticals, food-derived medicines, botanical herbal medicines, repurposed drugs, any immunotherapy that I feel like could be helpful based on the tumor-specific analysis, genetic analysis of the tumors that we do, or the liquid biopsy results, as well as surgery if the tumor is operable, either through traditional, I say traditional now, to me, it's become somewhat traditional, but it's through robotic surgery or through, nowadays we have new techniques, and we just had a patient with thyroid cancer that did ethanol ablation of the thyroid tumor, which you can do in certain types of thyroid cancer. So there's different radio frequency ablation, there's cryotherapy that can be used in certain tumors now. So it's really pretty cool, some of the different less invasive surgical-esque techniques that can be used, especially in smaller tumors. There's enucleation in the head of the pancreas that can be used, and for questionable lesions where they basically go in and just fry out the little section that's cancerous, and it's not nearly as invasive as it used to be. So yeah, but we use it all. It's a combination. And then there's also, we do work with our patients on mind-body.
Before we go there,
yeah,
I'd like to say that it's just so powerful. You made mention to Deep Blue AI and how that could make the difference, like really knock you off the fence, like on the way to no evidence of disease. And imagine having that at your fingertips, like knowing beyond the 6 to 8 week onboarding process, having that at your finger, having that.
You got to be straight with that, right? It's not like, oh, you sign up and all of a sudden we send you all this. Because it is completely customized, there's a lot of data we have to collect. And so the onboarding process is roughly 6 to 8 weeks. And there's certain we can prescribe as soon as we get the blood drawn, because we want to get a good, strong baseline. So as soon as we get blood drawn, urine collected, that kind of thing, then there are certain things we can get you started on that we know are generally broadly in most cancers, anti-neoplastic, and that kind of put the cancer on pause while we wait for all those results to come in, and then really do the targeted treatment protocol at that point. So on one hand, you shouldn't freak out by when we say 6 to 8 weeks, like I can't wait that long. You don't really have to wait that long to do anything, but it's more that you do have to at least get samples collected before you start any kind of treatment. And then it may take up to 8 weeks to get all the data collected and the initial protocol finalized.
Imagine having this level of detail at your fingertips. Having this suite of repurposed drugs going to work on the cancer, knowing exactly what to put in your mouth, nutraceutical-wise, food-derived medicine-wise, and also anything that you eat is also going to work against this cancer. It's making such a difference for our patients and for the patients that you've had over the last 15 years. And moving on, we've added a new aspect of treatment to the protocol, which is mind work. And it's an often dismissed aspect of treatment. And we've all heard the adage that we only use about 5% of our brains. So what I'm doing in this work is teaching you to harness more of that, more of the use of your brain towards the healing of cancer. And it's made such a difference for our patients. And through visualization, and through teaching our patients to access, an alpha wave state, sometimes within 10 seconds. Using the mind, harnessing the mind. There have been so many studies that Harvard and Stanford have done on these techniques, on visualization, on meditation, and the difference that it makes, in the process.
Yeah. And you're directly involved with that.
I am.
Which I wanted to say. I think that's important for people to know is that you're not just interacting with me, you're also interacting a lot with Madi. She's probably, I would say, you interact with her as much as I do almost in many cases. And that's really that you've taken on that realm of the practice. And I think it's a really crucial piece, which in the past people have had to go elsewhere to incorporate. Now we have it all in-house through your contribution.
Right. What an individual goes through, what you would go through being diagnosed with stage 3 and stage 4, it's almost as if a lot of people's emotions are dismissed. That they don't have a play, and there's a lot of anxiety and overwhelm, and people are terrified. They're really scared. I've spoken to so many people that they don't really get the support in this area, the mental, emotional, and spiritual aspect of their journey. And I think it's just so essential because we are feeling and emotional beings. Yeah, and it's very easy to have a mental thought affect your biochemical state.
Yeah. Well, and your biochemistry also has a big impact on your mental state as well, which is the other side. And I think that sometimes that's neglected as well in conventional cancer care because a lot of the medications that are used in conventional cancer care have well-known real effects on mental state, which on top of the person already also having cancer, which is in itself both a physiological and mental stressor. And then on top of that, now I'm going to be overloaded with toxic drugs, which also have mental emotional effects. It's a lot.
Yeah.
It's a lot. And I think having support through that process is really crucial. I would say it's something that I feel like everybody should have that's going through cancer.
All right. So,
and that's important, by the way. I said going through cancer, because really that's how I think of cancer. Cancer is a process that your body may be going through. And we don't relate to people like they're, quote, cancer patients. To me, I have patients, some of whom have cancer, right? And I think that, that doesn't mean they're going to have cancer tomorrow. And it doesn't mean that the cancer defines them, but it does mean that the process of going through cancer is something that they're dealing with right now. Right?
Beautiful. Language and those distinctions is so important to us because we deal in possibility medicine.
Yeah.
What does that mean to you?
To me, it's always coming from anything's possible. There's always something more we can do. I don't believe or adhere to this idea that there's nothing more we can do. That's something that you hear in the conventional cancer world. That's something you're never going to hear out of my lips. But to me, if we've approached it from 3-4 different angles, let's try approaching it from the opposite angle. Let's try approaching it. I mean, if we assume something is disease of immunity, which a lot of times people think of cancer as being either of genetics or immunity or the blind spots in the immune system. What about if we haven't addressed the nervous system, right? That seems like an obvious thing. Or, now we use a lot of anti-angiogenic treatments. So approaching cancer as a vascular problem is also part of the picture. So approaching it from these different angles is what gives you access to really the opportunity for a cure. Yep, I use the C word. But yeah, I mean, that's really what we want. That being said, we also have patients where, just whether it's due to the nature of their particular cancer or whether it's due to their priorities and what works for them in terms of treatment, we have certain patients where their primary focus is getting so healthy that they can live with the cancer in their body for decades. And I've seen that. I've seen patients who've lived with cancer in their body for over 2 decades, and they're living with their cancer, not feeling like they have to become cancer free, which is a little bit of a misnomer because all of us have cancer cells popping in and out of existence in our bodies at any time. The question is, of course, whether we can get the cancer levels below a detectable margin. And I think it's a nice goal, but if in pursuit of that goal, someone is making themselves even sicker, then maybe that's not the right goal. And so by pursuing optimizing health and minimizing the opportunity for the cancer to grow and spread while living with the cancer, that's a third option that nobody really ever talks about, but it's something that is certainly an option in our practice. And I think, yeah, I mean, it's fascinating what a teacher that can be, what lessons that can be learned through that and how it can help us stay accountable to living the way we need to be living. I will just say briefly that in my experience, and I don't have perfect follow-up with all of my patients, but I would say that to my knowledge, all of the patients who have been compliant at a level 98% or above, in other words, they've done 98% or more of whatever I've told them to do, as far as I know, they're all still alive today. Where we sometimes do lose people who have cancer is when they simply are not able to follow the treatment protocol, or they're not willing to. And that sometimes doesn't have as good of an outcome. So outcomes are really directly correlate to compliance, in my experience. I really don't have a situation where somebody, at least so far, knock on wood, but I haven't seen anybody where they've done everything I've told them to do, and despite that, they got worse and didn't make it. Just haven't seen it.
What is possibility medicine to me?
Oh yeah,
Like,
what is possible?
Pulling that around in my
Sure.
brain.
Yeah.
You are not an algorithm. You are not bound to be fed into this conventional machine upon diagnosis. You're not a cookie that we cut squarely or in a perfect shape in the way that we want to because it benefits us. And I'm talking about the conventional system. You're a unique individual. And we are going to do everything to honor that, down to your genotype, down to your genotype.
Which is like the way your volume control settings on your genes have ended up in life.
Yes, down to your mental and emotional makeup. Yeah, and it's I love that you said that, or that you really made that distinction in the language, that they are not our cancer patients, but they are our patients, our community dealing with cancer. And so there's an opening there to champion this cancer in a way that doesn't fit in a mold that most people have been taught and programmed to take on. Like, you don't have to take that on. Yeah. Okay, let's tie it all in a neat bow. The 3 main offerings that we, Aspen Wellness Institute, offers in the realm of cancer.
Yeah, option 1, option 2, and option 3. So as I was mentioning before, option 1 and option 2 are really the kind of most compatible with your original hypothetical of someone who's pursuing conventional cancer care, but they want something to go alongside it, right? Someone who is pretty overwhelmed by everything that's got going on with, maybe they're newly diagnosed, A lot of times those people will gravitate to option one just because it's, let's add a few things. It's incremental, right? So you're going to get access to ivermectin plus mebendazole. Those two are two repurposed drugs that work particularly synergistically together to help disrupt cancer cells and encourage them to commit suicide. Plus access to the basic elements of the Independent Medical Association, formerly the FLCCC, protocol from the tier 1 recommendations for cancer, my specific products that I recommend that provide those ingredients for our cancer patients and our patients with cancer. Sometimes I do slip up. But basically, the people who are dealing with cancer will be on that protocol from typically from Fullscript, but basically it's a nutraceutical protocol that they add in with the ivermectin, with the mebendazole, and on both of those, we have the option to increase the dose if the response is not as good as we would like to see. And all of that can be done alongside, even down to the multivitamin, multimineral that we use, which is one that was created by the Cancer Treatment Centers of America to be used alongside chemotherapy, radiation, etc. So that nutraceutical protocol, the ivermectin and mebendazole, plus you get access to the monthly calls where we have monthly group calls or community Zooms where all of our active patients that are dealing with cancer will come on and have the opportunity to ask questions. If you are on option one and you'd like to, you've done repeat testing, whether it be tumor markers, whether it be imaging, and you've seen your tumor has grown or it hasn't responded, hasn't shrunk at all, you may want to increase the dose. That's an opportunity to share that data with us. Let us know. And with your next round of prescription, we can guide you on how to increase the dose, and we can do that. And that's pretty much option one. Anything else you want to say about option one?
I do. So I know that there's a whole mass of people that are doing it on their own, getting their own ivermectin, and they're using fenbendazole. What do you have to say about that?
So first of all, the dosing of ivermectin, there's very few doctors probably in the world who have more experience than I do prescribing ivermectin. I prescribed it now to several thousand patients. And I would say that in terms of dosing it so that you don't, A, underdose it, so you're not going to get any benefit, B, not overdosing it, because we've seen some patients do that for sure, and C, preserving the therapeutic window. In other words, if you're going to increase it, increasing it very gradually so that you have an opportunity to further increase it should you need to, right? One of the pitfalls we've seen is certain people who want to self-prescribe. They get stuff from the feed store, which may or may not be absorbable, may or may not be full of a bunch of other toxic flavorings and bindings and chemicals. But then they basically get this stuff, and then sometimes they take so much that then they can't take ivermectin anymore because they start getting horrible side effects at even a tiny bit of a dose. So they've overshot the therapeutic window. So that's why it's important taking it under the doctor's supervision is a crucial piece of that, making sure that A, you're on enough, you're not on too much, and that when you're increasing it in a mindful, logical way that preserves the option to continue to take it. Bendazole is not FDA approved for human use. It's a veterinary only drug in the United States. It's not like ivermectin where there's like a human form and there's an animal form. There's only an animal form of fenbendazole in the United States. And so because of that, I, as a physician, a naturopathic physician, I'm not going to be able to ever recommend that anybody take any kind of veterinary drug. It's not smart. Like I said before, there's flavorings, fillers, binders, excipients, flowing agents, things which maybe are okay for animals, but not okay for us. Also, just the purity of the product and the potency of the product in general. The standards for veterinary drugs are not as high as for human drugs. So we don't even really know that you're getting what you expect to be getting. And we saw this a lot during COVID. People taking feed store ivermectin wouldn't necessarily be getting the kind of outcome we would expect until they switched to getting the compounded pharmacy ivermectin. And we saw that a few times from patients who had, because it took them time to get to us, they said, I'm going to start treatment myself, but then they weren't really seeing a whole lot of benefit. And then they switched over to the compounding pharmacy ivermectin, and they were able to get better much more quickly. One more thing about the fenbendazole. So all of the studies have all been done on mebendazole. Mebendazole is the agent that has been studied. Now, people assume, okay, fenben, it's in the same drug class, probably works similarly. Maybe not. It's hard to say without actually having the studies be replicated with it. I will just say that to me, if we can get it, and we can get it in a way that is where it's made for humans, and we can get the exact drug that was used in the studies, why would we not want to do that? Again, unless it's going to basically wipe out your life savings, which to get it from your local CVS, I'm not picking on CVS, I love CVS, but I love CVS. I like it better than Walgreens. Walgreens, I've got my eye on you. Anyway, the point is that would absolutely wipe out your life savings trying to get it from CVS or Walgreens. In this country, mebendazole is incredibly expensive. Even on the compounding side of things, it's still very expensive. But fortunately, through NMC, Natural Med Choice has been able to source mebendazole from a licensed, certified, top-of-the-line pharmacy in India. And through that mechanism has been able to open it up to a lot more people, a price that is a lot more reasonable than, frankly, you're going to get anywhere else. So, but we do have both options. We have the US compounded as well as the Indian pharmaceutical, human pharmaceutical version available now through NMC. And both of those options are available to our patients on option 1, 2, or 3. So those are things we feel pretty strongly about. We wanted to make those available, which we have. And NMC has been a great partner in that regard. Anything else you wanted to say?
Yes, I just
about
want to
option
make
one?
an insert that we are not aligned with anybody getting their nutraceuticals or repurposed drugs from Amazon, from a Facebook ad, from a feed store.
Anywhere where you're able to get a drug without a prescription, you should be immediately suspect of that. Because A, it's illegal. And so given that it's illegal, they have no incentive to actually provide you with what they say that they're providing you. Think about that. If you want something that's illegal and I'm like, oh, look, you can get this illegal thing here and pay this much for it, what's my incentive to not just give you sawdust in a bottle at that point? I have no incentive to do that. I should just, because I'm going to get the same amount of money from you either way, and I have the same level of liability either way. So why would I not just maximize my profits by selling you sawdust in a bottle? Because if I have no integrity to the point where I'm willing to do something illegal to you in the beginning, why would I not just go all the way, right? So just think about that. Think about, again, follow the money, think about the incentives. Just, think 2 or 3 times or how many ever times you need to think to realize that if you're going to do something for your health, you should do it through a legal means to make sure that you're getting what you're paying for. Because is it better to spend $100 to get a bottle of sawdust or $200 to get a bottle of an actual medication? I'll let you answer that question for yourself. Go ahead.
All right. Moving on to option 2. Option 2 includes everything that is in option 1. And it is an expanded suite of repurposed drugs and also access to the oncology specific diet and the suite of nutraceuticals as well.
Yeah. So basically, it's access to, first of all, just a little bit about how option 2 onboarding works, right? So because you're doing the oncology specific nutrition plan, you're getting everything you need to be able to do that, including the blood testing and all that kind of stuff. You're also getting the kit to be able to do the measurements and send those to us. And while you're working on that, we're getting your biopsy results. We're either getting a liquid biopsy for you, or we're getting your biopsy results transferred to either LabCorp Oncology, or we use Guardant Health, some different molecular testing companies we use, depending on your specific cancer and the details. Excuse me, one or the other may be better. That's going to allow us to look at all the genetics of your cancer for treatment. So what specific, either chemotherapeutic, immunotherapeutic, immune modulators, or metabolic inhibitors are going to be most effective in your specific cancer. So it goes it goes far beyond, let's just say, breast cancer, right? It goes far beyond, are you estrogen receptor positive, progesterone receptor positive, HER2 neu positive, but really looking at the specific oncogenes and antigens which are positive in your particular cancer, far beyond the basics, to really target those treatments. And not just the pharmaceutical treatments, but also the nutraceutical treatments, because we do have receptor binding and genetic expression data now for most of the common nutraceuticals that are used, certainly in cancer. So that's a huge added benefit, because it's like actually giving you access to customizing your therapy, as well as information about clinical trials, which might be particularly indicated given your cancer specific genetic profile. So that cracks the door open. In fact, I always tell everybody, really, option 2 to me is the best value that we offer, because it gives you a lot of bang for your buck. You get access to any of those repurposed drugs that you want to take, and I go over with you how I pick them and what I would recommend starting with, at least in your case. And we have one one-on-one visit with me that's included in that, where we're going to go over the results of your tumor-specific genetic test. We'll go over your nutrition plan. We'll go over some initial nutraceuticals and repurposed drugs that I would recommend. And then for follow-up, you basically follow up on the community Zooms, and we can make adjustments and tweaks to your protocol at that point. And you still do all your lab testing through your oncologist, and you're still, but it's really more of, for someone who's very well informed, who knows the kind of drugs that they want to take, who knows the kind of nutraceuticals they want to take, but they want to get the prescriptions for those drugs. They want to do it the legal way. They want to get an expert, in this case me, recommendation on which specific products, because there's hundreds of curcumin products out there, doc, which is the best, right? I'll tell you. So this is the thing we do. So we really help them customize it to some degree. It's still mostly a DIY type program, option 2, because you're coming in and saying to me, this is what I'd like to do. I give you some basic recommendations. I give you access to all of it. So you get to decide, though, what you ultimately want to do and what you don't want to do. And then you follow up, same way as with option 1. Anything else you want to say about option 2?
Yes, I want you to share how versed you are on drug interactions, because you have this mix of repurposed nutraceuticals, and then you have whatever the oncologist is prescribing.
Yeah. Look, naturopathic physicians are the world's experts on both drug herb and drug nutrient interactions, as well as herb and herb nutrient interactions. So there's really not anybody else that knows more about that than we do. Unfortunately, your medical oncologist has no clue about any of that. Their general policy is don't take anything natural, right? Which is not helpful, frankly, because it totally ignores all the substantial research that shows that complementing their protocols with specific nutraceuticals and repurposed drugs substantially enhances the outcomes, right? So it's almost, don't do any of the other stuff. I mean, this is a cynical thing I'm about to say, but it's almost like they're like, don't do that other stuff because, and what they'll tell you is because it might interfere with the efficacy of my treatment. But the truth is what the research shows is that it might interfere in a positive way. In other words, make the treatment more effective. So you might need only 2 or 3 rounds of chemo as opposed to 5 or 6. Oh my gosh, but I have to put my kids through private school. My point is, they don't know anything about those interactions. We are the ones who are the experts. So if you have a concern about whether you can take a drug or an herb together, whether maybe because you're on a drug, you may need some extra of this nutrient, very common. There's a lot of nutrient depletions that come from taking pharmaceuticals, and making sure you're on the proper amounts of those nutrients, but not too much of those nutrients, because there's certain nutrients like iron that can feed cancer, copper that can feed cancer in the wrong situation. In fact, a lot of what we're trying to do in terms of encouraging apoptosis is through a process called ferroptosis, which is a subcategory of apoptosis, where we're using iron deprivation essentially to encourage the rapidly dividing cancer cells to kill themselves. So if you're supplementing iron at the same time as you're trying to engage ferroptosis, good luck, right? So just, they're not wrong that there are certain things you want to avoid. Obviously, that's true. But to say avoid everything is like throwing the baby, it's like throwing the whole nursery out with the bathwater, right? And if I seem a little heated, it's because I get a little heated. I'll never forget, I probably shouldn't tell this story, but he probably won't care now. There was one time where a patient had sent this was back when I was in residency. It was an email or a fax, and it was the recommendation of the oncologist not to take any nutraceuticals while they were doing the protocol. And the office manager was like, how do you want to respond to this? And Dr. Diadamo literally just wrote F you on the paper and gave it back to her. Because that's literally how we feel. It's like we spend all of our time, energy, and effort studying natural medicine, right? Studying nutraceuticals, food-derived medicines, botanicals, herbal medicines, and not just pharmacology, but also pharmacognosy, which is how the herbs actually do their work. How do they do their job? It's the natural pharmacology, right? And this is literally, we get more time and class time and clinic time on this than any other kind of provider out there. And yet we get these kind of emails and faxes and whatnot from the conventional medical doctor as if they get even an hour of botanical medicine in conventional medical school, which they don't. I know, because that's where I started. There was not even an hour of pharmacognosy or botanical medicine in the conventional curriculum.
Yeah, there's such a very limited view coming from the system. And it really has taught most people that this is the way to do it, and that this is the only way to do it.
Yeah.
Okay. Let's move.
Option 3.
Yes, option 3. I'll start by highlighting a case study, a recent one, where a gentleman is dealing with bladder cancer, stage 3, and has been given pretty much the ultimatum from his oncologist that you got to cut it out. Like, you got to cut it out. And
by that, you mean his entire bladder?
Yes.
Just so we're clear.
Yes. And hasn't really given him like full informed consent about what he would be dealing with if he were to have this done. Okay, so there's and so he has registered for our custom cancer care program. And just to see you go to work in like these beginning phases, ordering tests and calling the lab and really being a quarterback to his care in all the ways that, oh gosh, I know will make a difference, one. And who really does this? Like, he has access to not only all of your expertise and knowledge, but like the coordination of care and talking to these phlebotomists and these doctors, and really having a plan of action like right out of the gates. So that is in essence what our third option, the custom cancer care option, is about.
Yeah. Yeah, I think it's really, to me, it's about for people who really want to virtually hold their hand through the process, right? Who want me to handle their lab work, their imaging orders. They want me to fully customize their nutraceutical protocol, including things that may not be on the Independent Medical Association, FLCCC, cancer care document, but that come from my 15 years of experience in treating cancer naturally. Again, there's also other repurposed drugs that haven't made that list yet as well. So really a truly customized, I'll give you an example right off the top of the bat. So you can use in neuroendocrine tumors, there's something called thymus, which some of you may have heard called rapamycin, same molecule, but using that once a week has been shown to slow the growth of neuroendocrine tumors. So, but that's not on the FLCCC document yet. In fact, the FLCCC document, I keep calling it the FLCCC. The thing is we've now changed the name to the IMA, the Independent Medical Association. I'm trying to remember that, so I'm going to start calling it the IMA more. But just so you know, this is the same Frontline COVID-19 Critical Care Alliance that we were one of the first maybe 200 practices of, and really has been a great source of not only alliance with conventional medical doctors, but also in forwarding the mission of using repurposed drugs, not just in COVID, but in cancer and other diseases as well. So exciting.
And there's a bunch of conventional doctors that are starting to speak our language.
Yeah. No, I always say internally, we always say, look, we're winning because we have more people on our side, more conventional medical doctors on our side than we ever did before COVID. So if there's been anything that's been good for the future of natural integrative holistic medicine, it has been COVID, frankly. And as horrible that is, and as many people who died, and as many millions of people who died worldwide due to that bioengineered or at least manipulated virus, the impact of that, I think, is continuing to be felt and will continue to be felt, not just in terms of people's individual health, which we're seeing that too, and increased cancer risk, et cetera, but also in really waking people up to the reality of what's going on in the medico-hospital pharmaceutical complex. There's got to be a catchier way to say that, but you know what I'm saying. Yeah, look, I think about it from the perspective of one of my very first cancer patients. I'll always remember her. She came in with a stage 3 cancer and breast cancer, and we started treating her. And I also told her she needed to get a lumpectomy. So she got it on the schedule, but for some reason it was going to take them like 6 months to actually get her in for the lumpectomy. I think they were hoping that maybe it would spread, so they'd have to do a mastectomy or something. They were like, let's give it 6 months and then we'll see. So
in 6 months?
6 months. Anyway, so, but hey, I was like, hey, I'll take it, right? So we started treating her and she was very compliant. She's one of these 95+% compliant people that I have in my head. So then when they got her actually under the knife, they took the tumor out. They said, well, we were expecting a stage 3. And then when we pulled it out, it was the size of stage 2. But then what was really weird is when we looked at it under the microscope, it looked like a stage 1 tumor. And it looked like it was in the process of dying off. And we were like, I thought to myself, I told her, I said, I think maybe if we just kept treating you, eventually that cancer would have gone away. She's like, yeah, I don't know, but I don't know if I could have kept doing everything for another 6 months. I said, fair enough. But what was really cool is in that case, her medical oncologist even signed off on no further treatment. So she didn't have to do any chemo, no radiation, not even localized radiation afterwards. He said, look, active surveillance, you keep doing some of the natural stuff you're doing. We'll keep a close eye on it, but I don't think you need to do anything else at this point. I think they got it. And, as far as I know, that's been the case. And that was over a decade ago now. So to me, I see what's possible. And that was without even the repurposed drugs. We've seen stage 4 cancer go into remission with repurposed drugs, just true miracles, like wild stuff. So, and that's not everybody. I mean, some people, they have to increase the dose. Some people, and then the other thing I'll just say is I think some people want to like just do ivermectin. It's like that can help. But if you're just doing ivermectin, you have to expect results consistent with just doing ivermectin, which is just doing one thing. It's probably going to help, but is it going to by itself cure your cancer? Not in 90+% of cases, right? You may get a one-off where ivermectin was the thing in addition to whatever else they were doing that was needed. Maybe it was the kindergartner, right? In our analogy with the prize fighters, some people need 2 or 3 kindergartners. And I think that's probably the majority of people for sure. And yeah, and the cool thing about, we're doing molecular residual disease testing. So now we can actually see not just can we see any cancer on imaging, but is there actually any that we can pick up in the blood? Can we pick up any cancer DNA in the blood, any increased methylation associated with cancer in the blood? So we can much better monitor the effects of our treatment than ever before, and also whether we've truly achieved a cure or whether someone is at increased risk of recurrence. And all of that is now measurable in ways that it wasn't even 5 years ago, because the practical applied genetic technology has really exploded really since COVID, I'd say. So it is an exciting time. There's never been a more exciting time to be involved in integrative oncology. And I think I can see now, like over the horizon, truly an end to cancer as a killer. And the way it happens is the molecular technology that I'm talking about continues to evolve, continues to become more sensitive, more specific. We use machine intelligence to refine its diagnostic capacity such that we could be running these tests on every single patient every 6 months and screening. And if we find anything that's concerning, we immediately begin treatment with anti-neoplastic therapies, which is basically what we're doing already in our wellness plan. And then that person never actually develops a tumor that's visible on imaging because it stays microscopic and they end up dying from something else 30 years later, or it actually goes away. It reverts back into a healthy cell because cancer cells can do that. Or they can just induce, you can induce apoptosis and the cancer cell can kill itself, and then that's the end, which is the natural process, which is going on every day throughout our bodies. But just by encouraging those cells to do that again, we can prevent the cancer from ever developing. So, as far as I'm concerned, cancer's number has been called, and we are now, you and I have a stand, which is the end of human disease now. And really with cancer, it's like, we've gone from a world where it was like, yeah, if you're like 98+% compliant, probably, right? That was what I could tell people with cancer. Now it's more because we're able to catch it so early. If we're able to catch it so early and really make the diagnosis early, like it's as close to being a guarantee as can be a guarantee without it being a guarantee, right? Because you never want to guarantee anything in life. To me, the people who guarantee stuff are all snake oil salesmen, because there's no such thing as guarantees in life. We could get run over by a Mack truck tomorrow. As my 7th grade biology teacher used to like to say, that's how she wants to go out. But
That's a bit morbid.
yeah, she was a bit morbid, but she was fun. So yeah, but look, I would just say that it's really, for those that we catch early enough, the outcomes are very positive. And I'm not overstating it, I think, at all by saying that.
Yeah. So I want to mention that option 3 is also where we go to work, where we utilize the mind work as part of your treatment protocol as well. I will say that when I met with this gentleman in our initial conversation, he's scared. He's scared. He's terrified.
And I think that's a normal response.
Yeah.
For most people when they get a cancer diagnosis. What was that movie that was, I remember watching it when I was a kid. It was not that young of a kid. I think it had Shirley MacLaine. You know the one I'm talking about, where she dies from cancer?
No.
And it was like all the women were, this was from, I think the 70s or early 80s. And it was like, oh, there was the C word. Nobody would say it out loud. And it was just it was almost like they were worried that it was contagious, or if they said it out loud, they might get cancer. And I just remember that reaction that everyone had was just so human, but at the same time, I think we've evolved to the point where cancer need not be more concerning than any other complex chronic disease diagnosis.
Yeah.
Yeah. Does that make sense?
It does, yeah. I'm glad you made mention of that. So this gentleman, he was clearly, is the legacy of my life like going to be snuffed out, and I'm going to be taken by this cancer painfully. So he was in tears by the end of my meeting with him. So I think it really matters, this mental emotional support that is provided as part of this option to really flank our patients that are dealing with cancer with this kind of support in a way that really they're able to go through this process and still see like the light in life, like to enjoy and experience joy during this process.
Yeah. It's exciting times. Yeah. Truly, I will tell you that for me, being involved in the early treatment of COVID was, up until that point, the most fulfilling time in my career. But what I see as possible now through our early treatment of cancer is, well, early diagnosis, early treatment, and even late stage treatment, using this combination, truly holistic approach, right? Using repurposed drugs, using natural medicines, using mind-body therapies, using very personalized nutrition, lifestyle modification, is, to me, has the potential to be as fulfilling, if not even more fulfilling in the long run. So I'm very excited to be part of it, be very excited to be one of the first people doing it, really basically bringing the clinical trials into clinical practice and using the latest data, the latest science, and the most comprehensive medicine, using the best of natural and conventional to really provide the best outcomes for our patients.
I'm excited to be a part of it with you.
Yeah. All right, are we complete?
We are complete. So this is Mrs. Madi Partovi.
And I'm Dr. Ryan Partovi. Thank you for joining us on this episode of the Partovi Effect. Are we calling this an episode of the Partovi Effect?
We are, yes.
We are? Okay, good. All right, thanks for joining us on this episode of the Partovi Effect, and be well.
We're calling it the so long cancer part of the Partovi Effect.
All right, amen to that. Be well.